Welcome back. Back pain is one of the most common medical problems, I know, affecting 8 out of 10 people during some point in their lives. So joining us to chat about how to treat the problem is Guy Danielson with Precision Spine Care. Good morning.
Good morning.
So you have been in this industry for about 40 years. Tell us what you've learned over that period of time.
I'm going to start by discussing a little bit of the different ways we categorize back pain.
Sounds good.
The back pain itself can be divided into two categories. One of them is what we call regional or mechanical back pain, and the other one is back pain that's associated with pain down the leg and numbness and that sort of thing. And that's a different category, and I'm really not going to talk too much about that this morning. We'll save that for another time.
Okay, sounds good.
Wow, so a variety of injuries, maybe athletic or just maybe not, I guess through time. I mean, I notice every now and then I have a little bit, and I think we talked at the commercial break. You say I guess most people have an experience, maybe at some time, right? And then there's probably better ways to stoop and lift. I know I always hear, lift with your legs.
Back pain is so common that you cannot get very much attention for telling other people that you have it. So what the main problem that patients have, and we as patients have, is that we have to figure out how to get started. And there's so many different people that are involved in this that it's very difficult to know where to start. And one of the principles of being a practitioner is that you get, if you're a patient, what the doctor does is what you get. So the problem is, where do I start? And one of the nicest things that we have here in Tyler is that we do have a group. And the group is different specialists, and they're not all surgeons, they're not all pain specialists. There are sports medicine doctors that are in the middle of this. Also behavioral medicine, physical therapists, chiropractors. So when we see a patient, it really doesn't matter which specialist sees them first. We get the chance to help guide them, direct them in the treatment plan that is best for them.
Great. So it's all encompassing, which is fabulous.
Right.
Wonderful. Then you were telling me earlier that you've had back surgery yourself. So this is something you're familiar with as well.
I'm very familiar with it. I had back pain, the regional type, for about 10 years when this was back in the 90s. And I did pretty much just live with it and tried to carry on. And I was able to do that. And I did try to keep healthy lifestyle going because I think that's very important. But unfortunately, I ended up getting a problem with slippage of the spine that started bothering me more and more, and I ended up with a lot of pain in my leg and weakness and numbness. And next thing you know, I'm in the operating room as a patient on the table instead of as a surgeon, and Dr. Gordon did the surgery. This was about 12 years ago. So since then, I've been very fortunate. I've got it going. I'm very happy. I'm still in practice as much as ever. And I'm a good example of somebody that has been fortunate enough to do the right thing to get well.
That's great. Well, good for you. I'm glad you're okay.
Yeah.
Thank you. Me too.
And in some cases, people come to your office for services such as pain management. And how does that work? Obviously, that's probably more of a short-term answer.
All the things that are done commonly are short-term, and that includes medications, injections, exercise programs, surgery. They're all things that we try to not do. And the main approach now is to not emphasize the testing. We don't send people right out for an MRI scan. We try to keep them in a situation where they're really thinking about what they have to do to get well. And this involves a lot of the same health habits that we do, that we've been emphasizing, which include quitting smoking, losing weight, exercise, stress management, and various things like that.
Right, so it's the all-encompassing health aspect.
Always.
Okay. Well, thank you so much for doing us. We appreciate it, Guy.
Thank you.
All right,